25th is the World Lung Health Day. So it's something which is actually quite new. So we used to have COPD days, and it's now gone into Lung Day. And I think things have become more in limelight for a pulmonologist after COVID. Unfortunate but truth. We never had such social acceptance before COVID. So we were called as TB doctors, and so suddenly we became COVID doctors, and everybody from my whole clan would be after me that get me a bed in the second. So jokes apart, it was a sad time, but we never knew that we would get some sort of social acceptance this way. So this I speak on behalf of most of the pulmonologists in the country. So I am Dr. Bharat. I head the institute at Delhi Heart and Lung. And I'll try and in next 8 to 10 minutes talk about the novel approaches to tobacco addiction control. So I think a lot of things have been spoken, and some of them will be just reiterations. But if you look at this 2021 Global Tobacco Epidemic Report, I think they should have actually labeled this as the pandemic report. Because COVID has come and fingers crossed has gone, but the tobacco use would still looks like a pandemic which is in progress. We all have spoken, we are people who are involved in policy making. Unfortunately, we still have over 1 billion smokers worldwide. We have over 6 million deaths annually somehow attributed to tobacco use of various systems, not only respiratory. It is recognized that it's one of the most important cause of avoidable premature mortality. So that is the catchword. This is something which is avoidable, right? The pandemic came and swept across populations globally. Unfortunately, more or less was unavoidable. These are things which happen once in a century. But these things which we are getting used to and addicted probably are preventable. It's addictive, it's lethal. Half of all lifelong smokers die a direct consequence of their smoking. Unfortunately, we still, even as doctors, we don't still understand that nicotine dependence is a relapsing condition. Since the doctors don't understand, we are not able to pass it on to the public that let's not think it as a habit, think it as a relapsing dependence. So once we start looking at the policymakers will listen to us, and then only we will be able to get. So we will not get into the other aspect of why policymakers unfortunately do not want to look into or want to look the other way when we come to talk about smoking, when everybody knows how harmful it is. So at an individual level, the most tobacco users actually want to quit. That's a surprising thing. But they are unable to do it because clinically they are addicted to the substance. So that's why if you understand that it's a chronic relapsing condition as say an arthritis, right? So you'll seek help. People who have this think of it as a habit, so they will not seek medical help for getting over this addiction, right? So I think those are the important points. So a smoker is almost like playing a Russian roulette, if you understand. So he's trying to shoot and he doesn't know ki kis khane mein goli hai. So he is smoking every day. He's losing years of his life, 16 to be precise, once he keeps smoking every day. These are the effective control measures which we all have seen. You monitor, you protect people from abuse of tobacco, from tobacco smoke, offer help to them, warn them about dangers, as ma'am said, probably right, stop smoking, enforce bans as we are doing on certain harm reduction methods, raise taxes. But has this actually helped over the years? It has not. So tobacco addiction continues to be a problem. Lung cancer continues to be one of the most common cause of cancer deaths. And though safe and effective pharmacotherapies and behavioral treatments are available, unfortunately, people do not quit smoking. And this is despite the fact that if you look at this study, this is an old study, but it still holds true. Almost 68% of people are interested in quitting. That's a huge number. 7 out of 10 want to quit. Only 5 attempt, and only say 7%. So 7 out of 100. So there's less than 1 would actually stay quit. So those are the numbers. They want to quit, they can't quit. they can't succeed. It is because of the dependence as a substance. It could be with other substances, but we are talking about nicotine. The Indian scenario is we are the second largest producer and consumers also of the. I would be very happy if we still, I'm sorry, but we are the second largest producer. Let's get off the second part where we not only produce it, but we also consume this toxin. So that's the bad part. This was a GATS survey 2017. Again, figures. I think figures make more impact in a policy meeting. So just look at it. Almost 30% of our population uses tobacco in smoke or smokeless form. And despite, again, as I said, most of the people want to try, this survey said almost 30% want to try, the percentage actually remains very low. And you look at somewhere between 10% if you make both the smoking and the non-smoking tobacco as one, between 6 to 16%. So let's take a benchmark of 10%. So again, about 1 in 100 will act, 10% is like 10 in 100, or 1 in 10 would actually want to, will be sustained quitter. So that is the problem. So what we can do, I'm a clinical pulmonologist, so I'm not a community medicine specialist, I'm not a policy maker. So whenever I speak at such forums, I speak because I see the end point of these things. I have, coming here, I had to go and take my round because my ICU is still full. We are not into the winters yet. My ICU is still full of COPD patients, all of them because of smoking. I do a lot of interventions. I do lung biopsies. We are seeing lung biopsies positive for cancer in females who are 40, 42. And the one thing which is going to be common is that these are people who are smokers. Let's not put everything on pollution. There is a definite increase in number of female smokers in India, especially in metros. Right? And that is the reason that we have been, around 20 years back when I started, one of the first people to start bronchoscopies in Delhi, I could not believe when I had a female who was 36, I still remember, 36, and I was thinking that this is a mass, maybe some benign hematoma or something. It came out to be adenocarcinoma, and it was impossible. They could not believe, a well-off family, and they just could not believe. But they were even at that time into having parties and smoking, traveling abroad. So this is a challenge. The psychosocial approach, which we all know, is 5 A's: ask, advise, assess, assist, and arrange. This everybody knows. Why I bring into a presentation which is titled as Novel Approaches to Tobacco Control? Because I still feel this is novel because we don't use it. Novel things are ones which are new. Am I right? We have young people. So I think a lot of you are from community medicine background. I am so surprised that even in our consults as physicians, we hardly actually spend time on, so maybe a passing remark of by a cardiologist, "Arey, don't smoke, नहीं तो एक और stent लग जाएगा." So we don't have to be judgmental. Maybe I would be accused of sometimes doing it to my patient कि ये तुम मानते ही नहीं हो, हर बार admit हो जाते हैं, and you go back and you think every time me or the God can actually combine to send you back from the ICU. So I feel that the advices, the assessment, the assistance to these individuals who are looking to quit is very, very important. Nicotine versus nicotine. This somebody brought up, I think Dr. Harper's talk. So it's almost like Karthik calling Karthik, So we have a whole continuum of products which are nicotine, and maybe the worst or the most nicotine containing is going to be cigarettes. And as we go down, it would be something like a nicotine replacement therapies, which we use as doctors, but they have nicotine, right? So he was right that nicotine is not the problem, but nicotine is a problem because it is the dependence part. So you need to somehow take care of the dependence, because I have taken many talks on harm reduction, even in this hall, and I've been a supporter of harm reduction but I am a supporter of harm reduction not for the community but for my patients. I have been always very, very clear that these are things which we can introduce into the system for patients who are already suffering from COPD, people who have lung cancers. We don't want to make them keep smoking. And if they want to quit, they can't quit. We can at least reduce the risk. I am not like going into the community and saying, okay, you are a healthy individual, because I'm not sure that is India still prepared to take that responsibility to choose between less harm and more harm. Right? I'm not sure. So I don't know. We have seniors here. So this is the continuum. Nicotine replacement therapies are not novel. They are underrated. They are underutilized. I think this is something which we can, they are not expensive. So these are now well approved by all medical councils and bodies across as part of the cessation programs. But what is novel? I think novel is that we have drugs available, right? Novel is that we can use combination therapies of a drug with nicotine substance. That is novel. This whole chart is available since last 10 years. But we have novel delivery systems. So there are people who don't want to probably chew a cigarette, or we do not have availability of lozenges. So you can have nicotine inhalers, nicotine nasal sprays to actually substitute the nicotine, so that you can then gradually reduce the dependence, right? So that is another thing. E-cigarettes, very controversial. So I'm not going to debate. I can debate for 2 hours, but so this is approved in US as a part of smoking cessation programs. There is data available in reputed journals. It has to be critically analyzed to where they have actually done it. So let's not put it at a community level still, because if you have say 3,000 individuals being screened, it is too small a number when you have a billion smokers. So, but you have data which is very clear, published in even in the journals like JAMA and NEGM, where they say that odds of quitting cigarette smoke are more if you convert to e-cigarette. So this is a novel method in people who cannot quit smoking, not the first method. Again, even compared to NRTs, this is published in NEGM, that's mother of all journals. So they actually looked at a year-long cessation, and they found that if you compare both products, give equal behavioral therapy, the chances of 1 year abstinence are more with e-cigarettes. So what are the innovations? We have conquered the moon. We are almost thinking of now conquering the sun. So I think it's time that we can actually spend some time on conquering something which is a century old. No, we चांद तक तो पहुंच गए, घर पे तो हमने कुछ भी नहीं किया. So I think these are things that we have ma'am who has been my teacher, but I think as part of you are part of the government. So these are things which we need to, I know a lot of things are being done, but probably newer innovative methods to be looked. So quit lines have been set up. I know my alma mater, Patel Chest, has a tobacco quit line. Digital platforms are available across the globe like Smoke Free, which contains information, modules and crisis intervention strategies. But let's quickly look at smartphone applications. We all use smartphones. We are a digital India, right? My son is at IIM Bangalore. He says he comes to Delhi. He said, Delhi to bahut piche hai. In Bangalore, they say, even the rickshaw wala says, no cash, give me Paytm. So that's the level of digitalization which has reached. If it has reached one city, it would reach across the globe, right? We can use this. There are, WHO last year launched an app for tobacco quitting, right? So these are apps which give you real-time support, feedback. They track your progress. They offer encouragement. Sometimes they deliver strategies if you have cravings. So these are various, you can actually, if any, I'm not asking for a show of hand. If any of you smoke and you want to quit, you can go to these. These are on the Play Stores or on the Apple Play Stores, and you can actually download and use this. Text messaging programs, right? So CDC actually sends you text messages if you are involved with their quit smoking. They will give you programs where they will give you messages of encouragement. You can actually send a SOS messages if you are having craving. Somebody will call you. They will probably give you support. tell you how to go over that situation. So that's, I think, a very, very easy aspect of sending SMSs. You can, I still feel, ma'am, we get so many SMSs about so many things, right? This is not a difficult or expensive thing. This should be one of the take homes that the government should, we a few days back we got that big chunk of emergency message. Did you see, Lottie? Yeah, so we can have that type of a wired message to all if that don't smoke, and if you smoke, this is our helpline. I think let people be partners in, and you cannot force. I've been a pulmonologist for last 25 years. You cannot force people. Sometimes they say, "यार मैं तो बता ही सकता हूँ." So but that's the helplessness as a doctor, because it is tough. When you get addicted to anything, it is tough. Virtual reality, wonderful innovations. I think this is something which again we can use. You have these virtual realities, these are available internationally. I think they can be we are a IT savvy country, we can get these. These are where you can actually create situations. So you are using a virtual headset, you will be into a situation like you are in a party and you are the 10 of your friends who are smoking, and you will get the craving because you are in almost in the virtual world. Now with that you will be taught how to manage. So when you actually go to a party where 20 of your friends are smoking, you are already, you know how to actually go over those cravings. So you have these, there is a program called as Mind Content where they actually make you so go from smaller to larger craving situations and how you actually manage. And this is not, I'm not talking from the internet. These are research based evidences. So you have papers published in a journal like Annals of Medicine where augmented reality has been probably tried as a smoke and cessation. Then in 2023, the catchword is AI and ML, right? So artificial intelligence and machine learning, you can actually create situations and actually create how a particular individual can actually be motivated, right? So this is like personalized program for smoking cessation, because one size may not fit all. Not only, again, this is a PATH study which was published last year. Not only this, the University of Pennsylvania, the Penn School of Medicine actually went back and looked at almost 1.3 million people and their smoking habits and the drugs which they're doing, and they found that 8 medications actually could be repurposed. So you don't need new medicines. A simple drug like dextromethorphan, it's in most of your cough syrups, and there are drugs for Alzheimer's. These can be actually repurposed to actually take care of the cravings. Then games. You have a simple game. I was seeing, you can go, and what it does is you have to just, you remember that that the fruit ninja. Has anybody played? Only one girl, no? 3, 4. So instead of cutting that fruit, you are cutting the cigarette, right? So it gives you that, okay, I want to quit. So this is, so you have numerous number of such situational gamings available. So I think that is time well spent rather than on online gamings. And I think this is something which I felt when I was trying to look at what, when Sajna gave me this topic. So yesterday evening when I was trying to look, I said, I think this is something which we all wear smartwatches now. We hardly utilize 2% of the facilities which we have on the smartwatch, apart from it looking smart. We hardly use anything. So you can, there are bands available which, because of our physiological changes, so the heart rate, when you have craving, your heart rate will change, right? Your SpO2s may change. So you can have those type of things. It actually will trigger an alarm on your phone or on, say, vibrate, that you are having craving, right? So you need to take action. Or you can actually have a timed app which will tell you, okay, you need nicotine substitution every 6 hours. Because if you don't take it every 6 hours, this 6 hours, 30 minutes, you will get the craving and you may then land up going back to the cigarette. So you can have the, I don't know if you can have this type of a trigger into your phone where you can do. And again, published literature. So this is not just a smart IT guy coming up with a funding type of a app. These are proven published literatures which are available. And telemedicine, I think this is again one of the boons which occurred post-COVID. And it's been very helpful to a lot of my patients, because we used to, when you practice tertiary care, so a lot of patients come from outside Delhi, 300 kilometers, 400 kilometers. And I think it's been a very big boon, because we are not legally allowed to do telemedicine. So they save on the travel. A lot of them just want follow ups, just few tweaking of the medications. So I think, and this has been used, published literature in COVID, people who were onto the programs of smoking cessation, they actually utilized telemedicine. And now you have newer apps and newer software development where you can have chatbots. You can just say, okay, I'm having craving, some, you will get automatic messages, or then some counselor will come back to you and make you tide over that crisis, which may not be actually possible. You can't just run to a clinic or to Patel Chest, Saturday Sunday it is closed, then you will have Saturday Sundays, you'll smoke, and you'll say, I'm sorry, you were not there. So I think this is a good way. So finally, future research is occurring. Don't be disheartened, young guys and girls. We have monoclonal antibodies to block the receptors which give you pleasure with nicotine. So that is going to be something. One very new thing which is being tried is something called as transcranial stimulation. So you stimulate precortex of your brain, which will not give you that good feeling of. See, everything is about the. We have not touched. I think you all know it's the pleasure. The dopamine, it gives you the pleasure at that, okay, this thing is very nice. So it's, then you can use their drug trials for a few drugs which are occurring. This is a huge list which I downloaded yesterday of. So future is not bleak. We need to reduce mortality and morbidity in these smokers, especially those who are unable to quit. We have to prevent newer generation from getting addicted. So that is also a very, very big challenge. Fighting tobacco is a team effort. We are all here from different facets of medical profession and non-medical profession. But I think whatever we have done, it is minuscule. We need a lot of effort, a lot of progress is still needed. We have in a couple of days the World Lung Day. So a lot of it is because with Forum of International Respiratory Societies, our society, the FCRD, is also part of it, and we'll be doing few programs over the next week. And I think I'm pretty sure that as I extended the time, but that was the privilege I got by speaking last. So you can follow on the various social handles. I keep putting something to do with medical science only. So, and thank you so much.